Today we're going to talk about the warning signs of diabetes, an immensely important topic for everyone striving to maintain and improve their health. Today we'll explore not just the warning signs, but also the physiological conditions behind them, the risk factors, and the action steps you can take. So let's dive right into it. To start, we first need to discuss the early warning signs that you need to be on the lookout for. One common symptom is excessive thirst, medically known as polydipsia. When your blood sugar levels are elevated, your kidneys diligently work to filter out that excessive glucose, leading to dehydration. And this results in a constant feeling of thirst and frequent urination, known as polyuria. The body's increased effort to expel sugar through the urine not only dehydrates you, but also leads to further electrolyte imbalances. And you might also notice a significant amount of hunger, or what we call polyphagia. Your body struggles to utilize the sugars it's absorbing. Without adequate insulin or effective insulin action, glucose remains in the bloodstream instead of entering the cells where it is needed for energy. And feeling unusually fatigued is also another critical symptom. This exhaustion occurs because your body isn't able to efficiently convert the available glucose into energy. And as a result, your cells feel starved, leading to reduction to overall energy and productivity. But you may also experience blurred vision in the morning. And this happens when high blood sugar levels cause fluid to be pulled from your eye lenses, changing their shape and effectively your ability to focus. And over time, persistent high glucose can affect the optic nerve, leading to more serious complications in the eyes like diabetic retinopathy. Additionally, pay attention to slow healing sores or frequent infections, particularly in your skin, in your mouth, because high blood sugar can impair the body's natural healing processes and immune system, making infections more difficult to fight. So if you notice tingling or numbness in your arms or your legs, this could be a sign of peripheral neuropathy, which is nerve damage induced by prolonged elevated blood glucose levels. And age is also another factor, particularly for those over 45 years old. Insulin production may decline, and the risk of developing insulin resistance increases. Certain ethnic groups, African Americans, Hispanic Americans, Native Americans, and Asian Americans, tend to have higher rates of diabetes, possibly due to a combination of genetic predisposition and lifestyle factors. And mental stress also plays a role. Chronic stress and depression can affect how your body manages insulin and glucose, exacerbating diabetic symptoms. Recognizing these signs and risk factors can help motivate you to take action. Remember, increased stress causes more cortisol. Cortisol tells the liver to break down more sugars, which can be a significant problem if it's not controlled. And it's imperative that you understand that untreated diabetes can lead to very serious complications, including heart disease, nerve damage, kidney damage, eye problems, poor circulation. So knowing this can reinforce the urgency of recognizing symptoms early and acting on them. So now let's discuss the practical dietary changes that can help manage blood sugar levels. Low glycemic index foods is what we want to focus with. Foods that cause a slower rise in blood sugar, such as whole grains, legumes, and non-starchy vegetables. That should be the staple in all your daily meals. Fiber-rich foods incorporate fruits, vegetables, and whole grains into the diet. These foods enhance glycemic control by slowing digestion and absorption of these carbohydrates. You want to eat your healthy fats, particularly omega-3 fatty acids, found in fatty fish, nuts, and seeds. It reduces inflammation. It supports heart health as well. Choosing unsaturated fats over saturated and trans fats is extremely vital that you keep away from your diet. You want to balance your meal where you want to focus on portion control. Eating smaller, more frequent meals can assist in maintaining stable blood sugar levels and prevent these spikes. Pairing carbohydrates with proteins and healthy fats can also help mitigate blood glucose surges. And drinking water is so important when it comes to managing your sugar levels. When you're well hydrated, your kidneys function properly, allowing them to remove that excess glucose from your bloodstream. And remember that dehydration leads to higher blood sugar levels as the blood becomes more concentrated with glucose. And additionally, staying hydrated helps improve insulin sensitivity, enabling your body to use glucose more efficiently. And when you drink water, it also supports your metabolism, aiding in the process of breaking down those carbohydrates. This not only helps maintain stable blood sugar levels, but also promotes overall health. And the role of physical activity, I cannot stress more than anything. The importance of regular activity, just moving, just any type of exercise helps the sugar get into the cells so much easier. Aerobic exercise, cycling, swimming, walking, exercise helps muscle cells absorb glucose much more effectively, aiding in the maintenance of stable blood sugar levels. Even resistive training is also extremely beneficial. It builds muscle mass, which can enhance insulin sensitivity. Practicing flexibility exercises like yoga or stretching not only helps the muscles and joint health, but it aids in stress reduction. Practical tips include taking the stairs instead of the elevator, parking further away from store entrances so you can walk, joining recreational sports leagues, whatever it is. Setting these achievable fitness goals and tracking your progress will keep you motivated and accountable. And don't overlook the impact of stress on blood sugar levels, because high stress can lead to hyperglycemia, making it crucial to incorporate stress reduction techniques. Chronic stress triggers the release of hormones like cortisol and adrenaline, which I mentioned, which can elevate blood sugar levels. Consider practicing mindfulness and meditation to enhance emotional well-being, as well as practices that can help lower stress hormones and improve insulin sensitivity. Simple, deep breathing exercises provide immediate relief during stressful situations. Additionally, maintaining social support by reaching out to family, friends, or support groups can foster a positive environment for coping with stress. So know when to seek medical attention. If you experience significant weight loss, persistent infections, extreme fatigue, or any of these aforementioned symptoms that we discussed, you should consult with a healthcare provider immediately. Regular follow-ups become even more critical if you're diagnosed with diabetes, allowing for effective management and treatment. Remember, early intervention can prevent complications such as cardiovascular diseases and neuropathy, ensuring a better quality of life. I hope you enjoyed this video. Please share it with your friends and family. You'll be doing them a blessing. Please leave your comments below. I'm sure there'll be many. And most important, make it a great day. I'm Dr. Alan Mandell.